Hello, everyone. We'll start with chapter 39 sensory alterations. People are somewhat unique because they are able to sense a variety of stimuli in their environment. Stimulation comes from many sources in and outside of the body. Particularly those senses you have are the senses of sight, which are visual, hearing, auditory, touch, tactile, smell, which is olfactory, and taste, which is gustatory. There are additional senses, which may include pressure, pain, temperature, vibration, and even position, which people sense. And as a result, people are at risk for developing sensory problems. And as a nurse, you need to help meet those needs when they have sensory alterations. Okay, so you have scientific knowledge base. Sensory reception involves the stimulation of sensory nerves, fibers, as well as to transmission of impulses to a higher centers within the brain. Normal sensation, people feel and react to sensations when their nervous systems are intact. Um, so when that is intact, people usually feels those particular sensations. Perceptions or awareness depends on particular regions through the cerebral cortex, where basically the brain is specialized, the brain cells, and it interprets the quality and nature of each sensory stimulus. Sensory experiences include reception, which um, is a stimulation of a receptor such as light, touch, or sound. You have perception, which is integration and interpretation of stimulation. So how you interpret that stimuli. Reaction, only the most important stimuli will elicit usually that type of uh, normal sensation. So you have a case study where you have a Mrs. Alicia, and she's a 73-year-old woman who is at the Senior Health Center for what she calls her routine 6-month checkup. She has been visiting the Senior Citizens Center on a regular basis for the past 8 years. Miss Alicia has lived alone since her husband died 1 year ago. She lives in a single story 4-room home a few miles from the particular self center. Her son Rico lives 5 minutes away. Rico drives Mrs. Alicia to her visit. 6 months ago, Miss Alicia reported progressive hearing loss. Today, she reports having trouble seeing. So that is what the situation is with the case study. Okay, so you have types of sensory alterations. Of course, as you could hear with Miss Alicia, she seems like at first there was the hearing problem that Miss Alicia was having, and now she's saying that she's having problems seeing. Sensory deficits is a deficit in the normal function of sensory reception as well as um, uh, uh, perception. Um, Sensory deprivation is inadequate quality or quantity of stimulation. So that's just like if you deprive somebody of something. That's sensory deprivation. Sensory overload receptors. So as we were saying, the inadequate quality or quantity of stimulation. So if you're not getting any stimulation, that is considered um, sensory deprivation. Sensory overload is just like when you're getting multiple sensory stimuli and they're all coming in and you are just overwhelmed. What I wanted to tell you was you can have a number of sensory deficits. There can be age related ones like macular degeneration, which people have problems seeing, glaucoma, cataracts, and as well as like diabetic retinopathy. So, where you have those particular sensory deficits, you can have sensory deprivation, which the what I which usually leads to boredom, restlessness, increased anxiety. Um, a person is usually emotionally labile or so if they one thing is failure to thrive in children, which they call FTT, for failure to thrive. A lot of times you'll see that in people, children who've had sensory deprivation, where they won't eat, they won't respond, they won't do anything. And I've seen children even be put in foster care homes and they had sensory deprivation, and when they started getting that loving and that care and everything, all of a sudden their weight goes up. They start reacting to things and all of that type of thing. So those are things that you can look for as far as, for sensory deprivation and that type of thing. Sensory overload is just, I mean, you may have to change a person's environment. You may have to decrease the amount of stimuli. You hear people say they feel a sense of panic. They don't go to sleep because there's all types of things going on. The light is on too much. Maybe the music is up too loud. Maybe somebody over there talking too much, or maybe they're in a new environment and what they're taking in is so much. It's just like it's sensory overload, and that usually affects people as well, where they feel just like, oh my God, I'm confused. I'm having these mood swings and various things like that. So, as far as like your nursing knowledge base, um, they say that like 25% and 40% of people over the age of 65 have some type of hearing impairment. The incidence increases with age. Approximately 90% of adults older than 80 years have hearing loss. My mother, over the last 2 years, had a problem with hearing loss, and that's something that you really have to work on with them because it can affect their balance. It can affect you know uh, their cognitive ability and everything. They can tend to have more dementia. A loss of sensory input can cause feelings of grief for a person. It can cause anger. They'll act out. You'll see depression. You'll see loss of self esteem. So it's very important to try to get that back. Even with you noticing this and having their auditory function tested, a lot of times because of the feeling of loss of self-esteem or anger or whatever, you'll see them push back. But a lot of times, once they do what you tell them to do, they tend to be pretty happy because they'll say, well, gosh, I didn't even realize it was this bad. Same thing with sight. You get them fitted with some new glasses or contacts if they can if they qualify for that. And people will be like, wow, I didn't know my sight was that bad. I knew I was losing sight, but I didn't realize it was that bad. So as a nurse, it's your responsibility to try your best to you know help them. As a nurse, you will realize that there are certain things you where you do need to educate and provide older adults with skills to cope with these sensory uh, deficits. But there are certain things, like there are certain medications that are ototoxic, which affect hearing. Um, Various type of antibiotics or diuretics can affect hearing acuity, balance, and or cause ringing, tinnitus. And that's why we put all of this type of thing, you guys, together. You're learning about medicines. You're learning about just so many different things, it seems like, at once. But as you grow within your field, you'll be able to look at it and say, wow, okay, I see why, how all of this is kind of being put together. The environment a person is in, uh, if they have any type of pre-existing illnesses, like let's say if they have a peripheral vascular disease or strokes or neuropathy or that type of thing, and they can't feel, or retinopathy, which affects their sight. They've known that smoking tobacco affects taste bugs, and it affects your olfactory function, like your ability to smell. So you need to know about these things, and these things play a part when you're in the process of trying to explain to various people and patients, to give them that little extra information about what could happen to them when they're going through those processes. So you got the case study continuing. You have Peter, a 33-year-old nursing student, and he's assigned. That'll be you guys. And for the past month, he's been attending his clinical rotation and teaching health promotion. And he's enjoying this rotation because he's learning more about geriatric patients and is finding that they are very independent and capable of having a productive lifestyle. So we're going to bring him into the fold. So, of course, you guys, you're going to have to, when you're evaluating a person's senses, you're going to have to use your critical thinking, your knowledge, pathophysiology, along with pharmacology and communicating and questioning, uh, uh, as well as experience, personal and clinical, the things that you gather and that you recognize based on experience in the past, as well as you're going to have to try to be creative, and then you're going to be set various standards and be ethical and professional. So when you do your assessment, and you're using your nursing process to do your assessment, you guys, you're going to look at things that make a person at risk. You're going to look at their environment, like are they at a nursing home, or are they living in conditions where that'll facilitate them having various type of sensory deprivation or whatever. And you're going to look at things like, for instance, if they're in ICU, that environment can be very, very stimuli, like overload of stimuli, because of the fact that they got so much going on. You want to always take older people into consideration, uh, because about sensory loss and that type of thing. You want to look at a person's sensory status. You want to look at how they're performing their ADLs. You want to look at their lifestyle. Uh, are they able to retain social relationships? Are they able to work or they still functioning related to that loss. You're going to look at socialization with people because a lot of times that does affect their well-being. Self-care management, how they taking care of their self based on that sensory loss. Are they able to drive now? Are they able to go grocery shopping, write a check, use a phone? Different levels of things if their senses are not up to par. Um, like I said, they're gonna have mood swings and that type of thing. And then as far as hazards and you're going to look and you're going to see is there things going on in their environment that presents as a hazard? Do they have a lot of rugs that they could possibly trip on? Is there enough light? Is the area well lit? You know, there are a lot of different telecommunication methods and different things that people can have uh, meaningful stimuli. Uh, Also, a bird. What and when I say meaningful stimuli, do they have pets? Things that make them happy? Are they able to look at the news on television? Do they have clocks, family pictures, calendars, anything that can assist them to take care of themselves within their particular environment. And then from that point on, you are going to make sure that you have them have that physical examination and you're going to test things. You always remember, you guys, when you are doing them, when you was in assessment, there was various exams that you was doing uh, and you may not have to do them all, but you know some of the various exams that you was doing to assess whether or not a person could see, to assess whether or not a person can hear. You know, you might do just the whisper test as part of your assessment and say, wow, you know, and find something. But I needed you guys to be aware of everything. So you're looking at behaviors and various things like that, and then you're gonna look if a person has a problem with vision. Do they fall, or are they repositioning objects? Are they squinting a lot? Hearing, you got y'all know what it is. They'll look blank. They'll misinterpret stuff. Um, you know, they'll nod their head and act like they heard, but they don't. And touch, is it clumsiness? Are they knocking things over? Are they not identifying even painful things that they can touch? Smell. Uh, let's say you smell very noxious and very strong odors, and they have no idea that those things are smelling that way. Change in appetite, taste, and then that can result in the fact that they lose weight. And then, of course, position sense as far as balance and them having uh, uh, problems with that. But you always have to take into consideration, you guys, what a person's expectations are. So they, now that you know, you need to ask them, and you might need to tell them, you know, what do you expect from this nursing staff to feel that you know you receiving good care. And then once they tell you and you better understand, uh, ask them, what do you expect the care that we will be providing for you? So that they have a idea in case you want to explain what's going on. And it's very important for a patient to know what where their expectations lines up with what care they're going to be receiving. So that's a good time for you to clarify as a nurse. So the lady, Miss Alicia, that said that she can't see, and at first it was her hearing, now she's saying so they took her to an ophthalmologist, and she was told she had a cataract, which is very, very common as people get older, you know. Uh, so Peter learns that the Hispanic Latino individuals in the United States have a higher rate of visual impairment and blindness compared with the members of other ethnic groups. Visual field loss has a negative impact on health related quality of life, driving, distance, and peripheral vision activities, as well as a sense of independence. So, the first quiz, an elderly patient who lives in an adult assisted living facility mentions that he is experiencing hearing and vision line, changes. During your assessment, you associate this type of sensory deprivation with what? A, stable affect, B, altered perception, improved task completion, increased need for social interaction. I would say would be altered perception. The fact that they're experiencing hearing and vision changes, which is what's altered, is what the type of sensory deprivation that that person is receiving. So you do your nursing process, and then you have various diagnoses that may be related to sensory deprivation. One would be the nursing process diagnosis, which would be anxiety, fear, impaired physical mobility, hopelessness, risk for injury, deficient knowledge, impaired social interaction, bathing, self care deficit, and risk for falls. All of those nursing diagnoses are related to somebody that could potentially have a sensory deprivation. So when Miss Alicia, the lady we were saying, she says, I'm having difficulty reading and moving around the house. I cannot judge the steps clearly. And she said she's having difficulty judging distances, which is worse at night. Results of a home assessment show that Mrs. Alicia's home has dim lighting, which needs to be higher, stairs without handrails, and numerous throw rugs on the floor. Okay, so based on that, what diagnosis do you think that Peter will choose? There are so many. Risk for injury would be one. Risk for falls, you know, that type of thing. Okay, so you got your goals, and you set the goals with the patient as well as the outcomes, and make sure they're realistic and measurable, you guys. And then you rank the diagnoses in order of importance based on whatever the patient's safety, personal desires, and needs are. And then you collaborate with, excuse me, with the family and other professionals uh, and community, and with resources. So the goal is Miss Alicia's home environment is safe and free of hazards within 4 weeks. So what expected outcomes based on that would you include? So, what you do, patient can learn to adjust to sensory impairments at any age with the proper support and resources. So, what you're going to do, you're going to promote health. You're going to use assistive aids for the patient. You're going to do preventative safety for trauma and use of vaccines. You're going to screen and prevent. You're going to promote meaningful stimuli and establish a safe environment. And you're going to communicate with the patient as well and tell them what you see and what you may think is proper for that particular person. So you're going to do acute care. So you're going to orientation to the environment. You're going to use safety measures, communication, and you're going to control sensory stimuli. So you're not going to have things that or just overwhelming. You're not going to come in and you're going to overwhelm the patient with information and all these different things. With Miss Alicia, in her case, you may have to have occupational therapy or physical therapy or somebody come in. She already saw the ophthalmologist. She may need to get those cataracts removed. Um, but you're going to do things. You're going to make sure that she has hand rails and that type of things installed. You're going to clear her path. You're going to tell her it's important for you to have a little night light in here and not keep it so dark, in your environment. So you're going to do continuing care and restorative care with the patient. You're going to promote self-care, and what that does is it increases the self-esteem of that patient, and it enhances safety awareness, and they tend to socialize more. So what interventions would you apply to these uh, uh, for this particular patient? Sensitivity to glare increases because of clouding of the lenses. So that's why you need to decrease the light intensity. I mean, the light intensity needs to be 3 times as powerful for older adults to produce some visual acuity as for younger people. And of course, you're going to remove any type of hazardous things in the area. And so that's the type of things that Peter would do. So Peter's going to ask Miss Alicia at her next visit if she has experienced any trips or falls since the modifications were made to her home. He's going to ask Rico, her son, if his mother's having any difficulty moving through her home. And then he's going to conduct a home visit and reassess the home environment. Sometimes when you're working in the hospital environment, you may need to bring home care people in to make sure that transition or to make sure that that person is safe within the home. So always suggest, to the physician or anybody that they can get somebody appropriate in that home to help that patient. So, after you evaluate the nature of a patient's sensory alteration influences basically how you're going to evaluate the outcome. And that's also based on whatever goals that you have set. So, when a patient does not achieve whatever expected outcomes, you need to change the interventions or alter the patient's environment. And then you're going to ask the patient whether or not the expectations were met. So, what you're going to do when it comes to sensory and that type of thing, you're going to do what you need to work on those with appropriate rationale, and you're going to do what you can do for adaptations for that person. Like, you're gonna make sure that, like for instance, let's say they got a smell um deprivation. You're gonna make sure that you have smoke detectors and that type of thing just in case, because it's not gonna be a deal where that person tends to, they can smell smoke and be like, what is that, before the smoke detector go off. You're gonna make sure um you're gonna check that if they are a smoker, that they have proper ashtrays and places to put, that area, and tell them not to participate in that uh, behavior, especially late at night or when they may possibly fall asleep. Um, they have all types of lamps and lights and doorbells, and y'all know we have various things for that person to use to amplify the sound in their house, to signal to them that various things are the way they should be. You may have somebody that can't see very well, or you need to help them be able, the whole goal is to help them be able to function to the best of their ability. You have braille, you have sign language, you have wheelchairs, you have all kind of closed caption where they can read on the TV if they can't hear real well, with even with a hearing aid. Some people are pretty deaf when they where they a hearing aid, they may be kind of so far gone. So uh, this is the chapter, and this is what you take into consideration when you have somebody in that spot. So that is the end of this lecture on sensory, uh, and have a good one.